What do you think? Who are those patients who are at risk for kidney disease and need early screening?
Yeah, I think this screening for kidney disease is very important and pertinent. This kidney disease is quite common. Actually, if we do the screening, then we find across the world and Indian studies also that 10% approximately people in throughout the world they have some form of kidney disease, and most of them they have early stages of kidney disease. But in clinical situation we see that we get a lot of patients who are already in the later stages. At that time treating these patients is difficult, and then many of them present to in the end stage kidney disease. So there are certain group of patients who are at high risk. So obviously India is a developing economy, we cannot screen everybody because this is not cost effective. But some people, those at high risk like patient with diabetes, because diabetes is the most common cause of kidney disease, approximately 40% patient of kidney disease is because of diabetic. Then the patient who has hypertension, especially uncontrolled hypertension in the young people. I see a lot of young patients who come to me with kidney disease in the young age. They have hypertension which they have ignored for years, and then later on they are found to have advanced stages of kidney disease. Patients, people with cardiovascular diseases, because cardiovascular diseases are one of the most important risk factor for kidney disease. Obese people, and obesity is again a risk factor for kidney disease, and the patient who had family history of kidney disease. This is again a very important cause of kidney disease. So I think these at least five group of patients they should do their screening at least once in a year, and they should do their kidney function test, urine albumin creatinine ratio to detect the kidney disease, kidney problem if they have any in early stages, so that we can prevent them or at least treat them and slow the progression.
Right, and it's very important to tell our general public that the blood test like a creatinine and urine protein is very cheap, less than 500 rupees both put together. And it's very important for them to go and get themselves screened, especially the high risk group that you just talked about. I just want to move on to the indiscriminate use of native medicine in our country. Obviously, they've not undergone any scientific trials, and some of them can affect kidney function. How do we tackle this?
So we all see, the India is an ancient civilization, and a lot of Ayurvedic and the other alternative form of medicine they are being used for ages. So up to a certain extent, for the common illnesses, we all use these remedies at home. But then using these remedies without proper trial, and in a lot of patients, because these drugs have not been medicines have not been tested when we have new methods of the diagnosis, blood test and the ultrasound and the CTs and an MRI, and giving these medicine can actually harm patient, you and me and most of our colleagues. A lot of people who actually take these medicine in the garb that their kidney disease would be cured, but ultimately they come with a lot of complication. So I would say that government should ensure that whoever is claiming that these medicine can cure, they should do some trials or something,